Former hospital nurse Niels Högel has been found guilty of killing 85 patients in his care. Prosecutors said that he deliberately induced cardiac arrest in patients so that he could then resuscitate them and impress his colleagues.
It was obvious he wanted to be the action hero who saved people.
Niels Högel, a nurse well regarded by his colleagues, was standing beside a patient's bed on a fateful day. With a syringe in hand, not filled with life-saving medicine, but with a lethal dose of ajmaline, a drug that would soon push his vulnerable patient into cardiac arrest. As the injection pierced the patient's vein, the deadly cocktail began its swift work, sending the body into chaos. But just as Niels was about to play the role of the heroic savior, the door to the room opened. A colleague entered, catching Niels in the act. Panic flooded the room. The colleague had seen it. He had been caught red-handed. This wasn't a one-time mistake. It was a window into something far more chilling. How many patients had Niels done this to? How long had he been playing this deadly game? And most horrifyingly, how had he gotten away with it for so long? Now, before we continue, I'd like to ask you a small favor. Our channel is still new, and every single subscriber helps us grow. Your support motivates us to produce even more in-depth, high-quality content like this. So if you're enjoying these deep dives into medical mishaps and want to stay updated on future videos, please consider subscribing. It's a simple action that would mean the world to us and ensures you never miss out on any new cases. Now, without further ado, let's get back to the case. Niels Högel was born on December 30th, 1976, in Wilhelmshaven, a coastal town in Lower Saxony, Germany. He grew up in a seemingly normal environment, raised in a family with a history of medical professionals. Both his father and grandmother were nurses, which influenced Högel's early decision to follow in their footsteps. By his own accounts, Högel's childhood was unremarkable. He described it as protected, free from any significant trauma or abuse. Högel attended school in his hometown, and after completing his basic education, he decided to pursue a career in nursing. His choice of profession appeared natural, given the family tradition, and it wasn't long before he enrolled in a nursing program in Oldenburg, a nearby city. During his training, Högel gained proficiency in the clinical aspects of nursing, especially in the intensive care unit, ICU, where he would later work. After completing his nursing training in 1999, Högel quickly secured a position at the Oldenburg Clinic, working in the cardiac surgery intensive care unit. His career seemed promising. Colleagues initially regarded him as diligent and capable, noting his ability to remain calm in high-pressure situations. He received praise for his work ethic, and there were no obvious warning signs of the horrors that would soon follow. However, beneath this professional exterior, Högel harbored dark urges that would gradually reveal themselves. His time in the cardiac ICU exposed him to life and death situations regularly, which, rather than challenging him professionally, seemed to trigger a fascination with the power he wielded over his patients' lives. This desire for control over life and death began to manifest in dangerous ways. As Niels Högel began his career at the Oldenburg Clinic, he quickly found himself drawn to more than just the routine tasks of patient care. Working in the cardiac surgery intensive care unit, ICU, is unlike typical patient care settings. The patients admitted are often in critical condition, requiring constant monitoring and specialized treatment to manage heart failure, arrhythmias, or post-surgical complications. Every minute can mean life or death, and the medical staff has to be on alert around the clock. This high-stakes environment could overwhelm most medical professionals, but for Högel, it became an arena where he could play a dangerous game of life and death. For Högel, this stress-filled ICU seemed to fuel his desire to manipulate these scenarios, transforming his responsibilities into a twisted experiment. Högel became fascinated with resuscitation, which led him to experiment with several medications, all of which had profound effects on the heart. Ajmaline, for instance, is an antiarrhythmic drug used primarily to treat irregular heart rhythms. When administered in excessive amounts, it can cause severe bradycardia, abnormally slow heart rate, or even cardiac arrest. Similarly, sotalol, another drug Högel used, can cause QT prolongation, a dangerous condition that leads to irregular, rapid heartbeats, and in high doses, sotalol can stop the heart altogether. These drugs, when misused, can result in rapid and often irreversible deterioration, especially in patients who are already compromised. For a layperson, the clinical application of these drugs is meant to manage and stabilize critical heart conditions. However, Högel's misuse of these drugs turned them into tools for harm, intentionally pushing patients into life-threatening situations. This was followed by his attempt to revive them, which he did to showcase his skills to colleagues, satisfying his desire for recognition in the most sinister way possible. By 2001, the internal investigation that took place at the Oldenburg Clinic was triggered by the unsettling rise in deaths and emergencies. Colleagues had started noticing a strange correlation. Whenever Högel was on shift, critical incidents spiked. At this point, the medical staff didn't directly suspect foul play, but rather saw it as an unfortunate coincidence. It's important to understand that hospital settings, particularly in ICUs, often see unexpected deaths due to the severity of the patient's conditions, which made it easier for Högel to operate without immediate detection. However, what was peculiar was that 58% of the resuscitations and deaths during the preceding months had occurred while Högel was on duty. Despite this, the investigation did not lead to immediate action, partly because it is notoriously difficult to pinpoint malpractice without clear evidence. There was no precedent for such deliberate harm from within the healthcare team itself, and the hospital administration likely viewed the spike as a statistical anomaly, rather than a red flag for serial murder. When Högel took sick leave following the 2001 meeting, the number of deaths and critical incidents dropped significantly. This should have been a glaring indication of his involvement, but hospitals often attribute changes in patient outcomes to multiple factors, such as shifts in workload or random variances in patient demographics. This failure to act allowed Högel to continue experimenting with lethal medications upon his return. His transfer to the anesthesiology department, rather than a termination or a more thorough investigation, was a bureaucratic response to the unexplained emergencies, rather than addressing the underlying cause, Högel's actions themselves. Later, despite the suspicions of some colleagues, Högel was allowed to resign from the Oldenburg Clinic in 2002. Remarkably, he was even given a glowing letter of recommendation by the hospital's director of nursing, which praised his work and professionalism. And so Högel was able to secure a position in the intensive care unit at the Delmenhorst Clinic, where his actions would go unchecked for several years. Upon joining Delmenhorst in 2002, Högel was met with an environment similar to Oldenburg, with high-pressure care needed for critically ill patients. However, his colleagues initially viewed him as a competent and calm professional, which shielded his darker intentions for some time. The ICU, where lives constantly hung in the balance, became Högel's stage. Here, his fascination with death and resuscitation grew more pronounced, but at this point, no one had any concrete suspicions beyond whispers. The number of deaths and emergency resuscitations started climbing almost as soon as Högel began working at Delmenhorst. What made this rise even more suspicious was that 73% of all deaths in the unit occurred while Högel was on duty. Despite the unusually high number of fatalities and emergencies, hospital administrators failed to intervene early on, partly due to the difficulty in proving direct malpractice without concrete evidence. Högel's colleagues gave him the nickname Resuscitation Rambo, a telling moniker that reflects how frequently he was involved in resuscitation procedures. The sheer volume of incidents should have raised alarms far earlier than it did. The breaking point came in 2005, when Högel was finally caught in the act by a colleague. This moment occurred as he injected adrenaline, a powerful antiarrhythmic, into a patient's bloodstream. The drug, when misused, can cause severe cardiac arrhythmia and even sudden death. Once again, Högel had positioned himself as the savior, ready to resuscitate the patient he had just doomed. This time, though, a colleague walked in and witnessed the injection. This direct observation finally led to action. While it is shocking that it took this long for a concrete accusation to be made, it was this act that triggered the comprehensive investigation that would later expose the full horror of his actions. Following the 2005 incident, police launched an extensive investigation into Högel's activities, initially focusing on the deaths within a limited period, between 2003 and 2005, at Delmenhorst. This first stage was necessary because of the sheer volume of patients who had died unexpectedly during his shifts, as investigators realized that over 70% of the fatalities in the ICU occurred when Högel was on duty. This high percentage prompted the investigators to immediately suspect that these deaths were not coincidental. However, it wasn't until his arrest and further questioning that the investigation would expand. As the investigation widened, more alarming information surfaced. It became clear that Högel's activities extended back to his earlier years at Oldenburg, where he had been similarly involved in suspicious deaths. Investigators had to tackle an unprecedented task, identifying victims who had died under Högel's care across multiple hospitals and even internationally. This required the exhumation of over 130 bodies across cemeteries in Germany, Poland, and Turkey. The process of exhuming bodies and testing for traces of medication is a highly delicate procedure, particularly when dealing with cases that span many years. Bodies had to be carefully exhumed and tested for traces of drugs like adrenaline, sotalol, lidocaine, and amiodarone, all of which are antiarrhythmic drugs designed to manage heart conditions, but which, in high doses, can cause lethal cardiac arrest. In many cases, these drugs leave traces in the body's tissues even after years, but some bodies were too decomposed to yield conclusive results. While forensic experts were able to find traces of heart medications in several of the bodies, others had decomposed beyond the point of yielding conclusive results. This factor limited the scope of the investigation somewhat. Despite these limitations, enough evidence was gathered to link Högel to a staggering number of patient deaths. The revelations shocked the medical and legal communities alike, as investigators unearthed what was potentially one of the largest serial killings in European history. Between 2005 and 2008, Niels Högel faced multiple charges related to attempted murder at Delmenhorst. While initially sentenced to 7.5 years in prison, this was just the tip of the iceberg. During these proceedings, Högel downplayed his actions, admitting to unauthorized injections but minimizing the extent of his crimes. The 2008 conviction, however, did not mark the end of the case, as in 2014, the scope of his crimes took on a far more horrific dimension. German authorities, spurred by mounting suspicion, reopened the investigation into Högel's activities. This renewed investigation was set off by a tip from a colleague and additional evidence that had emerged from his time at both Oldenburg and Delmenhorst hospitals. Police suspected that the number of victims could be much higher than originally thought. The reopening of the investigation in 2014 under the codename Operation Cardio represented a dramatic escalation in the efforts to fully uncover the scale of Högel's crimes. The operation was not only designed to review patient records, but also sought to understand the patterns of care under Högel's supervision. Investigators meticulously sifted through years of data, including patient histories, medical logs, and unexplained deaths, identifying dozens of cases where patients had died unexpectedly during his shifts. The complexity of the case required investigators to interview former colleagues and witnesses, many of whom had worked closely with Högel but had failed to recognize the full extent of his actions during those years. The forensic process during Operation Cardio was labor-intensive, involving the exhumation of over 130 bodies from cemeteries across Germany, Poland, and Turkey. Toxicology tests aimed to identify traces of medications, including ajmaline, lidocaine, and other antiarrhythmic drugs linked to Högel's methods of inducing cardiac arrest. However, the challenge lay in the fact that many of the bodies had decomposed to a point where conclusive results were difficult to obtain. Decomposition often reduces the chances of detecting chemicals in human remains, particularly those buried for extended periods. Nevertheless, many bodies still showed traces of these drugs, confirming Högel's pattern of intentionally inducing medical crises in order to attempt resuscitation and gain attention. This pattern mirrored the behavior seen in Munchausen syndrome by proxy, where individuals, often caregivers, induce or fabricate illness in others for the purpose of gaining sympathy or recognition. By September 2014, Högel was officially charged with multiple counts of murder and attempted murder. His confessions during questioning added more grisly details to the case. Högel admitted to deliberately administering fatal doses of drugs to 30 additional patients. His goal, according to his own admissions, was to induce cardiac arrest and then stage dramatic resuscitation attempts in front of his colleagues. He derived a sense of gratification from being seen as a skilled lifesaver, despite being the architect of the very emergencies he was trying to resolve. As Operation Cardio progressed, the staggering scale of Högel's crimes became apparent. By August 2017, authorities announced that they believed Högel was responsible for at least 90 patient deaths, though the actual number could be far higher. Högel admitted to many of these killings, but claimed he could not recall the specific details of each case, a factor that complicated the full accounting of his victims. Investigators estimated that the total number of fatalities could be as high as 300, which would make Högel one of the most prolific serial killers in modern history. The Special Commission Cardio, tasked with leading the investigation, concluded that the deaths at Delmenhorst and Oldenburg represented only a fraction of his total crimes. The trial of Niels Högel, which began in October 2018, was an unprecedented event in Germany due to the sheer scale of his crimes. Held in the Weser Ems Hallen, a venue large enough to accommodate the 120 co-plaintiffs, the families of the victims, and legal teams, the trial became one of the most significant in post-war German history. This immense interest from the public, media, and law enforcement underscored the gravity of Högel's actions. Högel faced charges for the murders of 100 patients during his tenure at both Oldenburg and Delmenhorst hospitals. The age of the victims ranged from 34 to 96, with the vast majority being critically ill patients under his care. These individuals were vulnerable and in need of high-level medical attention, which made Högel's actions all the more horrific. On the first day of the trial, Högel confessed to 43 murders. His admission was startling in its directness, as he recounted deliberately inducing cardiac arrest by injecting fatal doses of medications, including ajmaline, sotalol, and lidocaine. These drugs, typically used to treat heart conditions, were misused by Högel to push his patients into life-threatening emergencies. Despite his confession, Högel claimed he could not recall the details of 52 other cases, but did not deny his potential involvement. The admission left a sense of uncertainty, as it became clear that many of his victims' fates would remain unknown. Throughout the trial, the testimonies from 32 witnesses painted a troubling picture of a healthcare system rife with negligence. Former colleagues, including doctors and nurses, acknowledged that they had harbored suspicions about Högel, but had failed to act. Some admitted to noticing a pattern of sudden, unexplained deaths, but hesitated to raise their concerns formally. Hospital administrators also testified, struggling to explain how Högel had managed to continue his killing spree for so long without being stopped. The trial exposed deep-rooted issues of silence and a lack of accountability in the hospital system. Medical experts provided comprehensive explanations of how the drugs used by Högel led to fatal outcomes. Ojmaline, sotalol, and lidocaine, when administered in the high doses used by Högel, could cause fatal arrhythmias, sudden drops in blood pressure, and cardiac arrest. For many victims, these drugs disrupted the normal electrical impulses in the heart, leading to rapid deterioration. Even patients who had otherwise stable conditions were quickly pushed into cardiac arrest. These explanations helped the court and the public understand the precise mechanisms Högel employed to carry out his crimes. A key part of the trial involved understanding Högel's psychological motivations. A forensic psychologist testified that Högel's actions were driven by a desire for attention and recognition. Rather than stemming from psychopathy or a direct impulse to kill, Högel's motivation seemed to be tied to his need to demonstrate his prowess in resuscitation. He admitted feeling a rush or thrill when resuscitating his victims, despite being the cause of their emergencies in the first place. This troubling admission highlighted the complex motivations behind healthcare serial killers, distinguishing Högel from those driven solely by violent tendencies. The trial concluded in June 2019, with Högel being convicted of 85 murders and sentenced to life imprisonment without the possibility of parole. This added to his previous convictions for attempted murder in 2008 and the 2015 conviction for 2 additional murders. Judge Sebastian Burman, presiding over the case, described Högel's actions as incomprehensible, condemning the systemic failures at both Oldenburg and Delmenhorst hospitals that allowed him to continue his killing spree. Judge Burman's final remarks highlighted how both hospitals had failed to properly investigate or intervene, despite clear evidence of misconduct. At Oldenburg, a spike in deaths had been noticed by hospital administrators, yet instead of taking decisive action, they transferred Högel to another department. His subsequent glowing letter of recommendation allowed him to continue working at Delmenhorst, where his killings went unchecked. The failures of the hospitals to act became a focal point for the public debate on accountability within the German healthcare system. In response to the case, German hospitals began to implement stricter oversight procedures. These reforms aimed to closely monitor patient deaths, investigate unusual patterns, and ensure that staff members could report concerns without fear of retaliation. Despite the widespread systemic reform, many of the hospital administrators and staff who had been complicit or negligent faced little to no legal repercussions. While some legal actions were pursued, many charges were dropped due to insufficient evidence, leaving a sense of unfinished justice among the victims' families. Meanwhile, Högel, in his final remarks, offered a public apology to the families of his victims. Many felt that his words were hollow, coming far too late to provide any real solace. The damage he had inflicted on hundreds of lives could never be undone, and for many, the scars would last a lifetime. His case remains one of the most disturbing examples of unchecked power in the medical profession, raising important questions that linger even today. Could stricter oversight and better reporting systems have saved lives? How did so many warning signs go unnoticed? And what steps should be taken to ensure that something like this never happens again? Should hospital staff who failed to act be held more accountable for their roles? These are the questions that echo in the aftermath of this tragic case. Let us know your thoughts in the comments below. How can the medical profession prevent such tragedies? And what should be done when lives are lost due to negligence or misconduct? If you found this story insightful, make sure to like, share, and subscribe to our channel for more deep dives into shocking medical malpractice cases. Don't forget to hit the bell icon so you never miss an update. And while you're here, check out our recently uploaded videos. There's much more to uncover about the hidden dangers in healthcare. Stay tuned for our next video.